Hey, my name's Adam Kreth, and today I want to talk to you a little bit about the value of the Orthophos SLAI. It is our top of the line unit. I like to call it the boat because it has everything that we offer. It has all of our software that's extra. It has a sleep study, all this cool stuff. And to understand this unit, and you should see it right now on your screen, is this unit was traditionally priced at about $116,995 up until the beginning of 2020, where we brought it down to 110. We have recently just got super aggressive with this unit, and we're now priced at 91,995. And the value is pretty incredible for what you're getting with this. To give you an idea, all of our cone beams now, they are 2D, 3D hybrids. That means you have a bunch of 2D pano functionality because inside the capsule is a 2D sensor, so you can take a regular pano. You can take a kid's pano, you can take pano bite wings, anterior bite wings, a TMJ shot, lots of cool 2D functionality. But it's also a 3D. So on the other side of the sensors, you have the 3D capsule, the 3D sensor inside there. And on the SLAI, you have fields of view that go from 11 by 10 to 8 by 8 to 5 by 5. So you get a really nice large shot, and I'll show you some of that in the software in just a minute. And then you also have a nice 8 by 8, and then the 5 by 5 is really, really nice for endo because it does increase the resolution to about 80 microns. The SLAI is unique because it comes with not only the implant planning software that comes with all of our units, but it also comes with something called CCAT Air, which is an airway diagnostic tool for sectioning the airway, colorizing it, patient communication tool to show if they have any obstructions in the airway. And then you also have CCAT Endo, which is basically, it allows you to measure from an axial view, top down, tracing each canal. It's really, really great for identifying canals that you can't quite see. Is it necessary all the time? No, but it's a really, really cool software to have. We also give you something called the Matrix Plus. So if you're into sleep and you're doing sleep studies now, that's awesome because what the Matrix Plus does is it takes it to the next level. It's also a theragnostic study. So if you're using the Matrix Plus, it's going to show you if the patient will respond to a sleep appliance, and if they will respond, at what protrusion should they be at to get the patient to respond. So you don't have to mess around for months trying to figure out where do you want to get them to. You'll know that, okay, 2 millimeters protrusion is what I want to get them to. In addition, SLAI, you get a ton of training. So with any 3D unit that we sell, the first training's with me. That's usually about 3 or 4 hours that come into your office. That's teaching your team how to position the patient, how to take 3D x-rays, 2Ds, how to use the software. My goal is to jumpstart you so that you're taking at least 2 to 3 3D images a day. That's what we're looking for. Following that, you get a Cone Beam Basics course, and that's going to be in Scottsdale or Charlotte with CEREC doctors. I know right now we can't really travel a whole lot, but they are lining up all these courses for when things open up again, and they're planning virtual trainings that will get you by until you go. That's a 2-day course. That's sitting in a room with other doctors in front of our computer with our software, really getting your hands on and asking questions with all your peers. In addition to that, we also give you something called clinical accelerators. So what we realize is when we give you all this technology, we also need to give you a bunch of training because we don't want to leave you out in the cold trying to figure this stuff out. So we come out with clinical accelerators. With this unit, you get 4 additional days of focused 3D training. So let's say you do some endodontics, you could do 2 days of endo-focused 3D training. If you do implants, 2 days of implant-focused training. Or we also have our ortho and restorative. You could do 2 days of both of those. In addition to those trainings, and those are also in Scottsdale or Charlotte, but in addition to those trainings, we also give you $2,500 of product from one of those divisions. So let's say you want, you're doing some ortho and you're doing some clear liners. We have SureSmile, really, really great solution. We give you $2,500 in value of cases of SureSmile. Restorative, if you're using CEREC, we give you Celtra blocks, burrs, a lot of other restorative materials I can't remember right now. Implants, Astra, Endo, Tulsa Endo, a lot of great stuff. Lastly, we give you another training, the SLAI. Since it is a sleep-focused machine, we give you 2 days of sleep training at 3D Dentist up in
my
Raleigh,
name is
North
Dr.
Carolina,
Erin Elliott,
with T-Bone
and I am
and Dr.
the course
Erin Elliott
director for
and Dr. Sully Sullivan. So we really give you all the stuff that you need to get the most out of this machine. So that's what the SLAI is. Let's show you a little bit of the images real quick. Hey, before I show you the images, I got to talk about something that we did launch on Monday this week on July 27th, and that is a combo option for the SLAI and the PrimeScan. And this is something that we've waited for a long time to get these two pieces together. And the reason this is really unique is, for one, you're getting that giant price savings on the SLAI that used to be $116, then $110. So you're getting that for a really good deal. But if you also buy that with the PrimeScan, which is roughly $45,000, we give you the CEREC design software for free. So the difference in those two PrimeScan units is like 45 to 70. So you're getting a gigantic savings there. If you were in the market to buy both of these at the same time, we give you a really, really good deal on that. And that goes through October 30th this year. Now, another piece I need to talk to you, we went through clinical accelerators. We also have something called the 1DS 2.0 rebate. So it's kind of an incentive club for you spending money with us in our consumable divisions, whether that's preventive, restorative, endo, implants, any of those things. So we break this into tiers, and the tiers are right over here. You'll see $25,000 to $49,000, $50,000 to $90,000, $100,000 and more. If you were to purchase an SLAI, you would fall into that second tier right there of $92,000. If you did that, and then over the course of this year, starting from January this year, all the way up until December, if you spent $15,000 with us in preventive products, restorative, endo, whatever it is that equals that $15K, we're going to give you a rebate check for $3,333. If you do it again in 2021, except the value then is $20,000 you have to hit. If you do that again, we give you another rebate check, same amount. And then if you do it in 2022, same thing. Now, let's say that you were in the market to do the PrimeScan and the SLAI. Now you're in the bucket of getting the $6,666 rebate. If you spent $15,000 with us this year, that's our COVID discount is at $15,000. You're going to get that giant rebate of $6,666. Same thing goes for 2021, except it's $20,000. You hit that amount. It's our goal of getting you to spend more of your time or more of your money using our products in your office from our other divisions. And I will tell you, in Austin, we have the best team: endo, preventive, restorative, implants, ortho, all of us. We work together really well. So that is a really, really good program, especially if you're going to do the higher tier. So what you're seeing right now is the Sodexis 4 3D exam window. This is exactly what pops up after the unit travels around the patient's head. It takes somewhere around 14 or 15 seconds for it to complete its loop. It reconstructs, takes about 1.5 to 2 minutes to pull all the imaging back together. And this is what you get. You get an extrapolated pano, so you automatically get a pano. You can very easily right-click on this and copy it, send it back over to your other imaging software, whether you use Eaglesoft. There's lots of things I can get into there, so there's some cool functionality. We give you this inspection window, which is essentially a 3D window sitting over the top of the 2D panoramic. You've got the skull view over here. You have longitudinal, that's your buccal lingual slicing. You have cross-sectional, just following along the arch of the tooth, and you have axial, top-down drone view. One of the things that makes Dentsply Sirona units so unique is the simplicity of this. If you can double-click on an image, you can move that inspection window wherever you want. This makes it really easy to sit down and have a conversation with the patient, to go through a 3D exam. It also makes it really easy for your team members to pick up on this software as well. It shouldn't be just left up to the doctor to figure this out. It should be up for the entire team to get to start playing with this software and having 3D conversations. Any one of these images can be enlarged. With your mouse, you can roll in and zoom in on the image. And what we're looking at here is an 11 by 10 image. This is our go-to. That's what the SLAI goes up to, is 11 by 10. We could also take this down to an 8 by 8. It's only going to capture the teeth. And then you got a 5 by 5. That's really good for just small endo shots. But this is the kind of imaging that you would get out of this. Super easy to use. You can pick it up in just a matter of minutes. It just takes a little bit of practice. And this is what I go through in the Jumpstart training. That's the first day in your office, is getting you up and running. Some of the other stuff that comes with our cone beam. So I had it listed on the first page, but there's something called an RCU. It's a reconstruction server. We give you a computer. That computer is designed usually to sit in your sterilization or in your server room, and all it does is reconstruct images. That's about a $4,000 computer. It's very powerful. So you'll get that from us as well. Things I recommend having is in your acquisition room. That computer should have some pretty good specs. 16 gigabytes of RAM, NVIDIA GeForce graphics card. And if you want to view it in your operatories, at least 8 gigabytes of RAM is good, and you should have a pretty good high quality graphics card. Not all offices start out using the software in all the rooms. That's something you typically work up to. But if you've already done that, if you already have good computers, that's even better. We just install Sidexis 4 in all of your rooms, and you can have 3D conversations right there with the patients. So that is the SLAI. We do have some other units below that don't come with all the other softwares and sleep studies. But this is, with the price right now, also with the combo with the Prime Scan, it's just a really incredible deal. I won't take up any more of your time. If you have questions, please shoot me an email back or give me a call. Reach out to me at any time, and I'd be happy to go through anything that you'd like to cover. Thank you.